So I am here with Kirstie Gordon Loiello, and Kirstie is a pelvic floor physiotherapist from Beyond Kegels. I think that's your company, right?
Yeah, that's right.
Yeah. Do you have other physios that are working with you right now, or you're just you? Yeah. But the great thing is that you do home visits, right?
Yeah.
That's why I end up referring Kirstie so often to my clients, because it's so nice that she goes to your house. Is there like an area like that I know you do have like a limit, right? What do you serve in Montreal?
I go pretty much from Beaconsfield, Kirkland in the west, and I go all the way to Atwater in the east. And then I have a clinic that I work out of once a week on Atwater. So anyone who's kind of east of there, northeast of there, they will often come and see me at the clinic. So it's cover a big variety. And then sometimes I'll see clients at my house in Lachine if they're kind of Laval, South Shore area too. So it's a little bit of everything.
So flexible. I love it. There's like so many options.
Yeah.
That's awesome. Okay, Kirstie, so we're here to talk about the pelvic floor, but we're not just going to talk about the pelvic floor, as we already spoke about, but the topic is pregnancy back pain, because a lot of the students that I teach in prenatal yoga, a lot of my doula clients, I really feel like the number one thing that comes up most often is they have questions for me about how to go about, finding ways to sit, how to use yoga to help them manage their back pain. And I have my go-to things, but I know that there's just so much more that we can offer them from the perspective of chiro, like we did last week, from the perspective of physiotherapy. So I know we were going to start with like the pelvic floor muscles and what role they play in back pain, but I mean, just go ahead. I want you to, tell us your take on back pain and pregnancy.
So usually people who come to see me with pregnancy related issues, it's either they're having some incontinence. Sometimes it's pain with penetration, so during intercourse, which often leads over into a fear of vaginal birth, because they're thinking if it's painful to have something go in, it's going to be painful to have something come out. And then most of what I see back pain wise is something that I call pelvic girdle pain. So basically, we'll go over our anatomy. So pelvic floor here, okay? So if we're looking at the top, this is our pubic bone, our two iliac bones, and our sacrum in the back. So if you're looking at it kind of face on, this is the front of me, this is the back of me. So our pelvis is made up of 3 different bones, 2 iliac bones, and our sacrum in the back. Often, where the sacrum meets the ilium, this is called your SI joint. This is often a location of pain. So if we're thinking of, if I turned around, we have 2 dimples in our lower back. That's usually the most common cause or site of pain in the SI joint. And then we also have the connection in the front. So our 2 iliac bones will meet in the front in our pubic symphysis, and this is called often symphysis pubic dysfunction. So SPD is often what doctors will call it. And this whole term, so SPD, SI joint pain, it goes under the umbrella term of pelvic girdle pain. So usually doctors will write down pelvic girdle pain, please assess, and it's really, I'm thinking of the whole pelvis as a unit. So what happens in pregnancy? Basically, we have changes in hormones, mostly an increase in relaxin hormone in our body, which its purpose is to kind of lengthen the ligaments and kind of lengthen, and it, at the same time, it weakens the muscles that help stabilize the pelvis together. And the purpose of this is for childbirth. We need that pelvis to be more mobile, to be able to expand to allow for childbirth. So relaxin often gets a bad rep, but it's not a bad hormone. It's just how our body kind of reacts to that hormone. That's really the problem. So what often happens is during our daily life routines with pregnancy, our postures change. We sometimes shift forward, we shift back. Sometimes we're weight bearing more on one side versus the other. Then over time, if we're thinking we're walking around carrying a toddler on one hip, so we do more of a hip shift. We're sitting in our office, we're sitting more on one side versus the other. Sometimes that pelvis, instead of being nice and symmetrical, those 2 iliac bones, sometimes they will kind of come out of alignment. So as a side note, the pelvis is a very stable structure. So often there is a lot of fear around pelvic girdle pain. People feel that they're like being split open. They're afraid to move because they don't want to cause any more damage to this pelvis that's very unstable. It's not the case. It's just that the pelvic bones have now shifted and they're now in a position that's causing irritation to your SI joint, your pubic symphysis. So what often happens is if we're weight bearing, if we have more weight on one pelvis than the other, we have a little bit of a shift. And then what happens is the muscles in our back on one side will often get really tight. Sometimes the groin muscles on the opposite side will get really tight. And that tension in those muscles will kind of pull that pelvis into a more asymmetrical position. And then the pelvic floor muscles, this is where they come into play, will either become tight through the whole pelvic floor, okay? So all of these muscles here make up your pelvic floor. So they can either be tight throughout, or sometimes it will just be one side that's tight, or even just several of the muscles that become tight. So it's kind of your body's way of dealing with this more increased mobility. Our body just goes tighten everything up to try and work on that stability. And then this over time can lead to more pain. So pelvic floor muscles per se are not the only cause of pelvic girdle pain, but they can definitely contribute by trying to be overactive to kind of stabilize that whole system.
Wow. Like such a great, visuals are so important. And
yes.
Yeah, you did a very good job at explaining that. It's always a good refresher for me too. I'm like, oh yeah, okay. I was like looking at those bones this morning and the names of them. So
yeah, people are often amazed to think like, oh my gosh, these are all like my Kegeling muscles. Like we just don't learn about this, especially as women. It's kind of a big unknown. So to learn that we have control over all of these muscles is really, it's amazing. Yeah.
wow. Okay, so then what, can pregnant people, what can they do during their pregnancy to help minimize the pelvic girdle pain, I guess, as we're calling it? Yeah.
So a lot of what we do during the first session is education. I spend a good chunk of the beginning session just talking about the importance of postures. So there's often certain postures with pelvic girdle pain that can irritate our symptoms. So we usually want to talk about anything that's symmetric. So again, with pregnancy, we have a tendency to kind of shift on one side. We want to think then when that happens, we're kind of taking our pelvis and we're twisting our pelvis. So anything that's more symmetrical when we're standing, trying to have our weight even, or shifting it back and forth side to side can really help. Really important to talk about breathing. So when we have a lot of pain, sometimes we do more shallow breaths, especially as pregnancy progresses. It's harder to take a really nice diaphragmatic breath, but that's really important for helping to kind of calm that whole nervous system, which usually gets kind of upregulated as we're having more pain with our movements. So it's really important to just kind of talk about learning how to relax that whole system as well, often through yoga, meditation. Those are my go-tos. And then what we try and work on is really working on symmetry. So a lot of what we promote is just trying to get that pelvis to become more symmetric as opposed to kind of being pulled out of alignment. We want to work on some symmetry exercises. So that's kind of when I see people for the first time, we'll often just get right into those symmetry exercises. So those are things that they can start doing at home right away. So I'm going to try and show you. I'm just going to try and set up here to see if you can see me and hear me.
Yeah, I can hear you still.
So here.
Cool. Awesome. We get a demo. I love it.
Can you see my feet?
Yeah.
Yes? Okay.
Well, I can't see your feet. I can see your knees.
Okay. If I turn.
Yes. If you go on your side, then we can see your feet.
So if we are here, can you see my feet?
Perfect. Yes.
Okay. So what we're going to do, so if someone comes to see me with that SI joint pain in the back, one of the first things that we can do is try and kind of loosen up that joint. So it's a really easy home exercise program that you can do. So we're lying on our back, we're bending the knee on that painful side. So if it's my left side, we're bending my left knee. I might not be able to stretch my leg out completely, but the other leg should be straight. Then we're thinking, we are bending this knee. And what we're trying to do is we're pushing that heel into the ground and we're trying to pull the heel in towards your bum and then push it away from your bum. Only thing is we don't actually want it to move. So we call it's an isometric exercise. We're pushing down and then we're kind of pulling in without letting it move, pushing out without letting it move. So if I was doing this at home, I'm pulling in for about 3 seconds. I'm pushing out for about 3 seconds. Pulling in, pushing out. We can do that a minute, 2 minutes, 5 minutes, sometimes if it feels nice. And what the purpose is that we're contracting the muscles in the front of our thigh and the back of our thigh to help kind of move that pelvis and the sacrum. So it helps loosen that up. As soon as we've done that, we go right into what we call a butterfly stretch. So again, I'll just
I'm thinking Baddha Konasana, cobbler. Is that your butterfly stretch?
Oh, that I have no idea. I know some yoga terms that
Yeah.
way.
Well, show us. So yeah, that's the yoga posture there. That's called cobbler. Yeah.
Oh, there you go. So now I know. Yeah. So what we're trying to do here is we're promoting the relaxation of these groin muscles that come into touch. Right? People sometimes say like I have a pain like right on the outside of my vagina, or it feels like lightning crotch. So those muscles come and attach right in here. And what we're trying to do is relax those muscles, which helps pull that pelvis back into more symmetrical position. So we want to lie on our back. We want to relax those muscles and taking really nice deep breaths all the way into your lower belly, thinking about relaxing that pelvic floor. Okay.
Kirstie,
So
does that also?
Sometimes I'll put my hands right on my pubic bone and just think about taking a nice deep breath. Letting everything expand through here, relaxing everything and breathing out. Yeah. We can also place pillows, yoga blocks on either side of your leg to make sure that it's really nice and comfortable and we can relax there. And we can stay there 5-10 minutes if it feels nice. Then before we get up, now we're thinking that we've made the pelvis more symmetrical. Okay, we've relaxed those muscles, we've opened everything up. Now we want to strengthen on top of that relaxed, more symmetrical pelvis. So we really want to get those glute muscles working to help pull that pelvis in nice and tight. So in this position, we're going to think about squeezing our feet together, and then we're going to think about pushing our heels down into the floor. Okay, so still lying on your back, I'm pushing my feet in, pushing them down as I breathe out, pushing down, 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 breathe and relax. Push them down. We hold it for about 5 seconds. We do it 5 times. Then right away after, we're going to bring our knees together either on their own or you can help with your hands. And we're going to do some glute bridges. So we're thinking having knees close to the bum, heels close to the bum, and we are going to lift that bum up, really using these glute muscles to try and pull that pelvis together. Again, we do that about 5 times. Okay. And then we can roll over and get up.
I'm so excited, Kirstie, because you essentially just did a sequence of movements that I do pretty much in every single one of my prenatal yoga classes.
So it's a pelvic floor therapist named Cecile Ross. She's dedicated her studies to pelvic girdle pain in women, and she's created this series of movements. And I think it's like 92% of her clients that she sees for pelvic girdle pain in doing those series of exercises multiple times a day, often will come and see her the next session or within 2 or 3 sessions, and their pain is at least decreased, if not gone. So really important series of movements that you can try multiple times throughout the day that can really help.
Wow. So I just had one question, because I know often I try to avoid in my prenatal yoga classes putting pregnant people on their backs for too long, especially later in pregnancy, because obviously it's uncomfortable, it's harder to breathe. So if someone was really not comfortable lying flat on their back, could they maybe elevate their back a little or even do it seated? Would that still work? Or
it's not as effective in the seated position, but yes, definitely like reclined with several pillows, as long as we can relax and keep those legs as open as possible and really relax that pelvic floor. Sometimes when we're sitting, we just can't get that full relaxation into the pelvic floor. But yeah, any position is better than none at all. So you just work with what you're able to do. Yeah. And then after we've done those exercises, basically we've brought them back into symmetry. We've done a little bit of strengthening with the glutes. Then we want to work on strengthening kind of the outer system. So in our body, we have different slings that we call them that go across our body. They always cross in the midline. So we have ones that are more from our adductors down here that cross right across to our obliques. And when those muscles contract, basically they are going to compress our sacrum. So we want to work them from the front. We also work them from the back. So our glutes and our lats, when we get them to fire, they come across and they help stabilize that SI joint. So what we want to do is, some people are afraid to move when they're having low back pain, but really the stronger your muscles can be, the more they can help pull that pelvis in, the better off you can be. With pelvic girdle pain, often we avoid exercises standing on one leg because, again, if we're thinking, it kind of shifts that pelvis. What you'll learn about me is I don't really follow recipes. So it's not that everybody gets this exercise and this exercise. If someone comes to see me and they can do a lunge, no problem, then we stick with doing a lunge. There's no worries. Other people, it's painful to stand on that one leg, so we do more squatting exercise or bridging exercises with both feet on the ground, and we kind of build up into that. And my main thing with pregnancy, my main little mantra is we monitor and modify. So as we go along in pregnancy, if things start to feel harder, we make sure the form is right. If the form is okay, then we just kind of change that exercise off if it's not feeling good anymore. And I'm like, my last thing, I'm just looking at my app here. There is a wonderful app that I often tell clients to get. It is called Rost. I will see here. Rost.
Oh, I think I've heard of it before.
Rost Moves Mama. So it's basically the Cecile Rost, the physiotherapist who does her pelvic girdle pain. She made an app with all kinds of daily activities. So getting in and out of the car, lifting, reaching, sitting, sleeping, stairs, standing. And she has a list of do's and don'ts. So again, I'm not a huge fan of lists, but if you're trying something, if it's painful for you to sit or to stand up, she has really great exercises. So here's a list of do's with some pictures. And then if you swipe, there's a list of don'ts. So it's a really
ROSS?
ROST. And
Wow.
then Moves Mamas. It's a free app, and it's great. If you have a question about something, it's a great little reference. So again, it's more like that education piece to try and help get people feeling confident to move.
Awesome. Okay, I'll find it. I'll put a link in
that'd be great.
show notes. Awesome. Oh my goodness. Okay. Was there anything else, Kirstie?
I'm just going to stress the importance of, so clients that I see, I love seeing clients prenatally. So even if people are not having any pelvic floor issues, the pelvic floor is just such a vital piece, especially postpartum for recovery. So even if we're not having any issues, it's really great to get a prenatal pelvic floor assessment to make sure that we're doing our Kegels properly. Should we be doing our Kegels? Because a lot of people with pelvic girdle pain actually have a pelvic floor that's too tight. So we need to learn how to be able to relax the pelvic floor. Sometimes there's actual individual muscles that are really tight. So sometimes we'll go in and massage those muscles to try and create some balance. If the pelvic floor is really tight, sometimes baby has a harder time coming out because it gets stiffer on one side. So it's not as easy for the baby to pass. So it's really great just to check in with the pelvic floor physio prenatally, just to make sure that everything is moving well. We understand how the pelvic floor works and that we understand, should we be doing Kegels or should we be working more on relaxing our pelvic floor?
Mm-hmm. Yeah, and I've started definitely recommending that to my yoga students, to my birth doula clients, that they in fact do that, because I think for a long time the emphasis was go see a pelvic floor physio after you give birth, right. But I think it is equally important to go before birth.
And it's also really great to, if clients are comfortable, but the sooner into their pregnancy, the better, but to actually check with the mirror if they're comfortable to see what their vulva looks like. Because I have a lot of clients who come and see me and they say, you know, I was able to look postpartum and I don't know if this was supposed to be there or if it was there before, or it doesn't look the same, but often we haven't really checked prenatally to see, you know, what everything looks like and where it's placed. Again, because it's just inside, it's just not something that women often do, but it can be just really empowering to understand how everything works, where everything is, so that you have a better baseline postpartum to be like, you know, I know this wasn't there and it's lower and it's, you know, it doesn't feel the same. So you have a bit of more of an idea of, you know, your pre and your post, what it looks like and what it felt like.
Oh, such a good suggestion.
Mm.
Excellent. Yeah, and I think that you said is early. So if somebody was going to come see you prenatally, is there a time in their pregnancy that's like the best time to come, or any time?
Before they get pregnant, I'm like, that's the ideal time. Otherwise, it's usually after the first trimester. So we just don't do anything internal until they've had their 13-week ultrasound. Everything looks good. And then we're basically, unless they're on pelvic rest, if there's any reason for pelvic rest, so no intercourse, and then there's no reason why they can't come in. And often the sooner the better. So we go over posture and breathing and movement and exercise. We check for diastasis, a lot of education. We talk about, pelvic girdle pain, and just kind of throw all this information at them. So as they progress through their journey, if something feels off or they start having some pain, they already know to come in or what tools they can use to try and help them along.
Cool. I love it. The earlier, the better. It's like when we're preparing for birth too. I think
Exactly.
the earlier, the better.
Yeah.
Don't leave it to the last minute. All right. Thank you so much, Kirstie. This has been super informative. I know I've learned a lot. And yeah, I look forward to continuing to send my clients your way.
Great. And ditto. I always recommend yoga. Is super important to work on mobility, especially prenatally. So, and it can really help with calming down that nervous system. So yes, much appreciated.
Great. Okay. Well, thank you. And we'll see you soon.
Take care.
Okay. Bye.